Hey guys, John Eller from Digestive, Nashville. Back with you, back with Ashton. We're here today to talk about digestive health. If you haven't read the blog post yet, go to bepainfreeforlife.com and search digestive health. You'll find it. We're going to talk today about, the blog post talks a lot about the key to proper digestion. We believe that all the systems of the body are connected, not just musculoskeletal, but also digestive, reproductive, lymphatic, adrenal, immune, etc., etc. So the body's a unit, everything's connected. Digestive has said the key to proper digestive health is being able to touch your toes. Now, a lot of you who can't touch your toes think you have tight hamstrings. We at Digestive believe you have a lack of range of motion in the pelvis. So I'm going to take you through 3 exercises today to increase range of motion of the pelvis, to reseat the shoulders, which will therefore in turn increase flexibility in the hamstrings. That's how it's going to present to you. You're going to come out of these 3 exercises and be able to go a little bit farther in terms of touching your toes. So Ashton, we're going to come into static extension. So if you have a block like this or like an ottoman or something, you're going to get your knees up on the ottoman and your hands down on the floor. Good, right there. I'm going to have Ashton drop the head, drop the shoulder blades together, and she's putting a little bit of an arch in her back like she's sticking her butt up in the air. Hamstrings stay nice and relaxed. I don't want to see the feet up off the block. We want the hamstrings nice and relaxed. Pull the shoulder blades kind of down towards the waist. Head is totally relaxed. That's one of the keys here. I'm actually going to shift her weight forward just a little bit. We want the shoulder right in line with the wrist from the side view. A little bit of an arch in the back here. For those of you with lumbar back pain, if this gets too painful, if this is too much to handle, we're going to modify this a little bit. Go ahead and come on out of it. Bring the knees down on the floor. So we're going to modify it. We're going to get rid of the block. I'm going to have Ashton start with the hip and the knee right in a line, shoulder and wrist right in a line. From there, I want you to come back just a little bit to our starting position. There we go. So this is our starting position. Now I want you to walk your hands forward, one hand length. Now we're going to shift the weight forward. Drop the head, drop the shoulder blades, arch that low back. So same position, not as much demand as the previous position we were in on the block. Again, low back pain if this gets to be too much. All I'm going to have you do is just shift your weight back a little bit and hold that. We want to work up to somewhere between 2 and 3 minutes, either in this position or the position on the block. So that's static extension position. The next one we're going to go to is called, go ahead and relax out of that, we're going to do an upper spinal floor twist. You may have seen us do this one before on some of our videos. Slide down this for a little bit more for me. Good. I'm going to have you on your side, kind of in the fetal position, arms out on top of one another, bottom hand slid a little bit farther away from you than the top hand. Knees and hips at about 90 degrees. I'm going to bring Ashton's arm over the top. Head is going to follow the hands. So look at the hand for me. Right hand is going to come right here. Hold the knees together. As you open up, don't let the knees slide. Keep them stacked. The top knee right on top of the bottom knee. As you're in this position, I want Ashton to, when she inhales, push my hand out. Perfect. On the exhale, she's going to try to drop this shoulder blade a little bit closer to the floor without the knees moving. So we're trying to rotate that spine, that thoracic spine, but not by cheating through the hips and let the knees slide. We're going to go at about a minute to minute and a half on this side. Then we're going to close up. We would have her flip over and do the same thing on the other side. And then we're going to finish our 3rd exercise called cats and dogs. So come over on your hands and knees for me. So starting position is the same as the static extension. Hip in line with the knee, shoulder in line with the wrist. I want you to arch the spine up towards the ceiling and let the head drop. And then we're going to reverse this position. That's our cat. Reverse this position. Spine comes down, head comes up, shoulder blades go together. Up into the cat. Down into the dog. 10 times. So those are our 3 exercises. Static extension position, upper spinal floor twist, cats and dogs. Those are going to improve your hamstring flexibility, your hip range of motion, pelvic range of motion, which is going to give you a better digestive tract. Remember, the pelvis is like a bowl. If the pelvis is out of position, everything inside that bowl is going to fall. It's not going to be where it should be. So being able to touch your toes is the key to proper digestive health. These 3 exercises are going to improve your ability to do that, therefore giving you better digestive health and an all-around healthier life. So keep moving. Thanks for tuning in, and we'll see you next time.